Hey, what's up?
Okay, so I kind of had a question like on what you were meaning like the Medicare for all, like what I guess you fully your like I guess understanding or description of what Medicare is.
Yeah, so my ideal system is different than what Medicare for all would be, or even what Medicare is, right? So Medicare specifically applies to elderly people. Obviously, there are some people with disabilities that can get on Medicare, and like there are some exemptions, but for the most part, it applies to seniors. And it doesn't cover everything. For example, like it doesn't cover like dentures, doesn't cover eye care, it doesn't cover a lot of things that it should care. And a lot of people, even for the things it does care, they still have copays. I believe Medicare should be expanded, so not only for the people that it covers, so not just elderly individuals, but also I believe it should be expanded in terms of what it covers. I think it should cover everything.
So then wouldn't it, I mean, so I guess the Medicare for all thing wouldn't be a full like wouldn't be an accurate like point, I guess.
Why do you think that?
Medic because I mean, you're saying like, that's not what you're meaning.
Well, so I think it should be expanded, right? So I think that it should be both expanded
Yeah,
in
but I'm
terms of
saying you're saying
who it
Medicare
applies
for
to.
all, but yeah, we kind of do in a sense have that. I mean, we do, but we don't. So I'm saying that, kids who like their parents or if they're on food stamps or whatever, yes, they get Medicaid
Yeah,
and all
Medicaid
of
is
these
different than
things.
Medicare. Medicaid is
I'm
different. It
very
covers.
aware. I'm an insurance agent.
Okay, yeah,
Mhm. That's why I was kind of asking.
yeah.
Um just to ensure that you kind of had that. So yes, they are very different. But also where you said to change the entire Medicare system, it wouldn't be then Medicare. It would be a
Well, it's still
completely
Medicare.
different system.
So if you look at, like, for example, there are two main Medicare for all bills that have been proposed. One was by Bernie Sanders. One was by, another was by Pramila Jayapal. Bernie just reintroduced his in the Senate. And the reason is because it uses the existing Medicare structure, but it expands both coverage and who it applies to. And so it utilizes the same thing, right? So, like, for example, the funding for Medicare for all currently coming, or at least a giant portion of it is coming out of FICA taxes, right? And so, like, that structure would still exist.
Yeah, but here's going to be the issues that you're going to have whenever that happens. And this is going to become from one an insurance agent as well as a mom's view on this. Like my child last year, basically suddenly got sick. Literally out of the blue, suddenly. I had to take him to his pediatrician. I was able to make a same day appointment with whenever you turn to like basically free healthcare for everybody, you're going to get into these systems where you're going to be 6 months out, multiple months out for appointment, or multiple weeks out. In our case, we were very lucky to get in for the appointment the day we did, because if we would have even been a few hours later, we would have ended up in the peds office, or not the peds office, the pediatric unit in the hospital. And with that being said, you're going to end up with kids in a lot of other, like, you're not going to be able to get these appointments whenever you're needing them.
Yeah, so that's
And I
that's not
understand
true,
that
right? So
certain
so
doctors are,
we
yes, booked out for months, but whenever it is an immediate case and you are needing these, yeah, you're still currently able to get in though whenever it's needed.
that's also true of countries that have socialized medicine, right? So they choose
Mm-hmm.
to triage care in terms of need, in terms of urgency. Thankfully, it sounds like you have good insurance, right? Or at least, hopefully, too, you have at least reasonable insurance. I'm not sure what your premiums are like and your copays, but it sounds like you have decent insurance. There are millions of Americans that currently don't have that insurance, right? They're not covered. If their child was to become ill, they would have to make a very difficult choice. There are some parents that choose to forego getting care for their children because they can't afford it. And that's a very real dilemma that a lot of Americans exist with. So there's people that just don't have insurance. Also, there are people that do have insurance, but it doesn't cover everything. They could be left with a giant bill at the end of their stay. And also, just in terms of like
Insurance wasn't my concern on it. More of I'm saying the whenever you have people calling in for the doctor's appointments that don't, in a sense, need doctor's appointments, um, for the smallest little thing is what happens with this. Whenever everything is,
so
yes, that's what happens.
you can look at countries that have socialized medicine. You don't have people that just like are just like oh I skinned my elbow. I have to go to the doctor right away. Like no, like people do go to the doctor more frequently, but that's actually a good thing because they're able to get like preventative care and they're engaged. Like people,
But it's
arguably
not good
compared
whenever
to
you're taking appointments from people who are actually sick.
obviously that's true in a vacuum. That also exists in our system. You just happen to have more of the luxury to do that if you're more better off financially.
I'm talking about there's been times I've not been able to get my son to the doctor when she is absolutely like when he's absolutely needing to go to the doctor.
Yeah, and that's in the U.S.
Because
That's our current system. I'm saying that wait
yeah,
times
but
exist
so in a
in
sense I
countries.
guess like how is it going to change?
Well, theoretically, if we were to allow, for example, if we were to socialize medicine, we could like allow for greater things. For example, like the UK, they have more doctors per capita than we do. It's close, but they have more than we do. The highest doctors per capita in the world is Cuba. Actually, they have more doctors per capita than any other country. But so we could have more control in that way. Like right now, we have an artificial cap on doctors. We shouldn't have that. It's really terrible. But in terms of like what you're describing, you had to wait a long time in our current system. Like when you talk about wait times, that also applies to our system. It just happens in a socialized system, you wouldn't have a giant bill at the end of it, or you wouldn't have to weigh the idea of not getting care, even though your kid needs it. I mean, can you imagine a more traumatic thing than you are worried, like, should I be taking my kid to the doctor? But you're worried that you aren't going to be able to afford it at the end. Like, I can't think of a worse position to put someone in.
Yeah, I personally am not a when at that situation, I honestly did not have my son didn't have any health care. His dad was actually supposed to have the insurance on him and did not. Within the last year, I've gotten my insurance license, and I don't only just sell health insurance; I do also sell car insurance as well. So at that time, no, he did not have insurance.
And was
I
it really
didn't
expensive?
care about that.
But was it really expensive?
That wasn't my problem. That wasn't my care.
But that is a care for a lot of Americans. Like the cost of
But the
healthcare,
thing is, though, I
we
feel
pay
like
more per person
your
than
kid's
any
health
other country.
versus a bill.
No, don't get me wrong. On a personal level, I would say take your kid to the doctor. I would say that that is more important. Health is more important. I'm just saying that there are a lot of people where they are in very dire economic straits. They're not doing very well off financially, and they do say, okay, maybe we'll put it off until we're doing a little bit. Like these are decisions people make, and I disagree. Obviously, I do think health should be prioritized, but it's silly to say that when we have the most expensive system in the planet, that there aren't people that don't make those decisions.
Yeah, but you also have to think of whenever these kids and we're having appointments booked out months and months and months advance and they don't even have time for another appointment. And these kids are sick and they're needing appointments. Because
Yeah, people that
my pediatrician is a private pediatrician. So like we don't have an urgent care with ours. So ours is his pediatrician and he has one nurse practitioner. I
sure.
love them. They are absolutely amazing. They do have other doctors, yes, in their practice, but that is how his pediatrician is in, and it should not be like in a sense. I should not be forced to have to take him to another physician's office because our office and every office is now backed up for 6 months.
Like currently,
No, I mean whenever getting I'm saying basic healthcare of
but in
general
countries that
healthcare.
have socialized medicine, they prioritize based on need. If you have something that needs to be seen right away, like you get to go to the front of the
Who
line. It's
though
not
prioritizes that need?
the same way we prioritize it right now. It just so happens that right now there's also like cost to the factor.
But again, whenever you can't prioritize that need, so you come in day of, and you know what? You have over half of your day, all of majority of your basic appointments are already booked and have been booked for 6 months.
Here,
Where are these appointments coming from for like appointments of kids calling in today? Like, hey, my kid's running like 103 fever. This is going on. They can't keep fluids down. I think they have strep. I think they have this. Where are we
I agree.
prioritizing those appointments though?
Wait, yes, if someone has something urgent that needs to be seen right away, that should be prioritized. Yes.
So I'm asking and those aren't ER appointments. I mean, guess I'm also reading the comments with this. That's not an ER appointment. Strep is not for the ER.
I didn't say ER.
No, that's though like the comments. But with that point, where do you get to decide in a sense whose appointment that's been there for 6 months? gets kicked, so your kid gets the appointment at the doctor's office.
I'm confused. I guess do you not think that the person that has the more urgent thing should get to see the doctor first?
I'm aware of that, but how do you pick who has been waiting for 6 months? A
Well, I'm
person
saying,
who's
so
had this appointment for so
for
long.
example, if you have an appointment, for example, where a kid the kid is fine, like the kid's healthy, but it's a regular checkup, right? And you also have a kid that's in the situation that you described, I would say that should be prioritized.
Yes, but I'm saying, okay, imagine you're the one who's been on the wait list for 6 months. And now you get a
I'm not saying it's
call an
fun. I'm
hour
not saying it's,
before. They can't
I'm
tell
not
you,
saying
though, why your appointment's gotten kicked.
I'm not saying it's fun. I'm just saying if there's a kid that urgently needs it and my kid is perfectly healthy, it's just a regular checkup. I think the kid
No,
that
it's an
urgently,
appointment for you to maybe get into a surgery for something that you've been waiting for months.
well, if it's urgent, then I think that these decisions have to be made all the time. Like in hospitals, doctors have to make these decisions all the time in terms of prioritizing. Like that exists in our current system. Like I don't understand. Like me, like
I don't think you
the,
understand this.
well, the same doctor that would be like a pediatrician that would see a kid with strep throat is not the same person that would be performing surgery on me. Like these are different. These are different
Depending
people.
on how they're board certified, yes. I mean,
Well, these aren't the same people. Like these are different doctors.
no, my literal pediatrician is double board certified, but that's just another conversation, I guess. Um, but okay.
Wait,
No,
I'm sorry.
but
Wait, do you
seriously,
think that's like I don't even understand what the confusion is, right? So like, let's say I'm scheduled for a surgery. I guess it is like it's an urgent surgery.
whatever it is, whether it is something that you're needing blood work done, whether it is something you are needing seen a mole on your back that you find concerning, that you're supposed to, let's say, a female getting an IUD put in or taken out because you're having complications with it. Because primary care physicians can take these things in and out. So many different things you need to go to the doctor for that you've been waiting to go to the doctor and you've been waiting for months and you now get kicked.
I'm not saying it's good, but I'm just saying if like I said, I don't have the expertise to specifically say, okay, should the removal of the IUD take precedent over seeing the mole? Like I
No,
don't
but
have
I'm also
to make
saying,
those
like,
decisions. But I'm just saying that this seems like a fairly common sense thing is that you would prioritize the more urgent thing. Like if someone has
yes,
something
but
that's
I'm just saying, how, where is that then okay that you are kicking then the people that have been waiting for months?
like it's not like they would never see it; they would just be next in line, right?
Yeah, they would
Maybe
have
they're
to
not.
wait more months
Why would they have to wait more months?
because I guess is the next day completely open?
Like I said, they would just push it back, right?
How are these okay? I guess, like, how is the schedule like going to look? Like, is it going to be completely full every single day, or are we just going to leave it open and the first person who calls gets it?
What? No, no, no. It's not based on that at all. Like in other countries of socialized medicine, they have schedules, they have appointments. You just don't have to pay a giant bill at the end of it. Like it's works very similar to ours. It's like and like it's not like functionally different. Just the cost mechanism is substantially different. Like yes, it do like for example, if you're sick and maybe you're not going to the doctor right now because you can't afford it, and you could afford it with socialized medicine, is there a chance that those people will now go to the doctor? I think that's a good thing though. But the scheduling, it would just be roughly similar to our current system. Like if you like your doctor and if you really want to see, like you mentioned the pediatrician that you really like.
I
Obviously,
don't.
I mean, this is true of everything, right? Someone that doesn't have a preference for pediatrician, like when I go to get a haircut, if I really like the barber, I can wait a little longer to see the barber that I like, or I can go to any barber and then I might get to see it a little sooner. But like that's true of everything.
Okay, hold on. Let's just kind of okay. Let's go back to the very beginning. So with this though, with this, whenever it is allow it, let's basically everyone has the same amount of health care, whatever, and they are booked up for months. Okay, how are they gonna have? Are they gonna have basically openings throughout the day?
Maybe I don't know on the specific hospital, like on the specific doctor's office, if
I
they'll
mean,
have.
I think that needs to be kind of in this.
it would,
Because you have to look at
it
this
would
and realize there's going to be, in a sense, emergency kids who, you know what, they're going to need just quick antibiotics. They may have mono, they may
and
have strep, they may have tonsillitis, other things.
I'm saying a kid with an emergency situation should get priority. That's what I'm saying.
Okay. But what happens to the patients that have already been booked?
They will get rescheduled.
But I think that's the part of the issue.
Why is that an
What
issue? I understand
I
it's
don't
not. I
think you get
understand.
that. Like,
Well, it's not like is it ideal? If you I scheduled my appointment a month ago. Oh my gosh, this kid he cut in front of the line.
they
He had
can't tell you, they can't tell you that. They cannot tell you that.
and so there's a certain amount of trust that goes into it. You're like, I got rescheduled. That's unfortunate. There was someone I guess that needed it more than me. I don't have a life threatening thing. I guess I'll wait another week. Is it ideal? No, it's not ideal. But that happens in our current system. Like people get
Okay,
rescheduled
so
in our
how many
current
people
system.
then are going to lose their shizazzles? Basically, I just didn't want to cuss them live, um, because they've had this appointment for months
Like I
or
said, I mean,
weeks.
they would try to reschedule depending on the urgency of it. Like the thing you mentioned before was a surgery.
Like
If there's
maybe it's a
surgery,
mole they want to get biopsied.
sure, yeah, they would reschedule. It would work just like our current system. Like people get rescheduled in our current system. Like that, I don't understand. Like that, this currently happens. There are people like you meet people like this. They've done it. It's unfortunate, but life goes on.
I just don't think you see that. Do you know though how many people like flat out lied in the system, like during COVID, to these doctors and nurses? Lying to the doctors and nurses, sitting there saying, "Oh, I didn't have a cough, I didn't have a fever." Then once they got back there, yes, they did. How do you know they're not going to sit here and be lying that they don't have an emergency just to get in?
People could do that in our current system, though. I don't understand that could happen in our current system. Like someone could theoretically lie.
No, they
I don't think
did.
that's good. Okay,
Yes, they
sure, sure.
did. I have
In our current,
multiple. Yeah, no, I have multiple in this.
but that's our system. Like you're describing our system. That's what I'm saying. Like
Yeah, so
with
how
your,
is it not going to get abused in this again? That's what I'm asking. Where is this not going to be getting abused?
I don't understand. You're saying something that already happens. Why will this not be like? I don't understand.
I'm asking though, where is it not going to be abused even more when this, if
So,
we were to do healthcare for all?
so something I would point to, right, is you can look at polling data on this. So people rate their satisfaction with their healthcare system. Overwhelmingly, people in countries that have socialized medicine are happier with their healthcare. They self-report that their system is they love it a lot more. They are way happier with it. So that's one metric I suppose you can look. Like if you're saying people don't like being rescheduled, I would look at, well, what do people say in countries with socialized medicine? They like it more. For example, you can look at Canada. They have socialized medicine. They don't have exactly what I want. Their system does have issues. People in Canada are substantially happier with their system than people in the U.S. are, though.
Okay. I'm just saying, I've seen a lot of it. You have people already abusing a system. And I know a lot of people are saying, "Oh, poor people might help." I don't care. Like, I mean, whoever needs their health managed, like I've been in that situation, whatever. Also, yes, I do sell insurance. I sell home, I sell auto, whatever. I sell multiple kinds of insurance. It doesn't just matter on health, but still, I've had to study health. Um, with that being said, you have so many people who have already abused the system. It's, in a sense, you have a higher risk of it getting abused even more. Of it, these people know that, hey, you know what? Basically, when they know they can't get in for a few months at a time. No, I did not mean like I didn't care about poor people. I meant like I don't care who gets, like, I mean, everyone deserves the
Forget
same level
it,
of
it, ignore the comments. I have no idea what you're
yeah.
saying because you keep responding to the comments. I have
Basically,
no idea what you're pointing.
okay, so basically, whenever people feel like they need medical attention before others, not everyone trusts urgent care. Okay? Honestly, they don't. Not everyone does. Urgent cares have screwed a lot of people. Doctors in urgent cares sometimes have refused to help people due to the age of the children. Um, they've just either have really bad,
People in other
like,
countries, their urgent care a lot more than we trust ours.
And that's fine. That is completely fine. But I've seen, at least especially in my area, a lot of people will not use our urgent cares, and we have multiples of them because they will not do X-rays, they will not draw blood, they will not do lots of things.
That's what I'm saying. You're describing issues with our current system and saying, why does my system not fix what's happening right now? I don't understand.
No, I'm just saying, like, okay, you create a free healthcare for all. Okay,
Okay, everyone
you,
can get help.
yeah, everyone gets the free healthcare. Where do you not still have those other issues?
So, do I think that free healthcare solves everything? Do I think we will enter a utopia? No, I do not think we will enter a utopia. I think it will be better than our current system.
But in the sense of the urgent cares who still can't do X-rays, the urgent cares who still cannot do blood draws.
That I would say that we should try and fix that. But like when you're saying that, when you're saying still can't, that would imply that it's an issue in both systems. So isn't really relevant into the debate of whether we should do it. Like, right? So if something is an issue with both of the things, then that's not really a deciding factor on which we should choose.
And then also the practices, like the private practices, or even like not private practices, like the ones that are attached to hospitals and things like that. A lot of those places right now, you're currently out over 8 weeks, some even multiple than that. Um, yeah, sometimes they literally have to squeeze you in when there's not even an appointment because it's an emergency for your patient. But at that point, how many emergencies can you fit in?
Well, we're gonna have to try and fit all of them. Ideally, all of the emergencies will get seen, and there are
Because
going to be this.
not every emergency needs to go to the ER.
That's true. That
We
is
don't need
super.
to sit here and clog the ER.
That's super true. A lot of people, frankly, will go to the ER in our current system because they feel like that's where they can get seen, right? Because they don't have the insurance that they need to schedule an appointment, right?
Absolutely. They need, hold on, repeat that one more time. Repeat that one more time.
I
I want to
guess
make sure I heard you correctly.
the broader point that's being made, because I feel like we may be going in circles slightly, is that I understand that you have some reservations. I think that the crux of your worry is that too many people will try to get healthcare. Am I understanding that correctly?
No.
Okay, maybe then please elaborate because I obviously don't understand.
You're whenever it is, okay, doctors are already clogged up and out even more. When you have free healthcare, and I've seen it from the family members I have alone who do use Medicare, okay, or Medicaid, they take their kids and they take themselves to the doctor for every little thing. I've seen people do it, even going to the ER for a pregnancy test. Why? There's no need for it. Why are you going to it for a pregnancy test? You can go get one for $8
How
at the
wait,
dollar store.
I'm really sorry. This has nothing to do with what we're talking about.
No, it
Someone
does. Because hold on, it does.
someone someone
It does.
going
Let
to
me
the
let
ER
me finish
for
this. It does.
has nothing to do with what we're talking about.
Let me explain, and it does. Because not every single thing needs a doctor's appointment.
That's
The
true.
smallest scratch does not need a doctor's appointment. And that's the thing. That's where you're going to start flooding this for a while.
Except you can look at countries that have it. That's not what happens. People don't like it. You can go to Denmark. I've seen it. People get a scratch, they don't rush to the ER. It doesn't happen. Like I understand the worry, but I'm saying that we can look at countries that
So
have it.
that's why I've been held up in ERs, and many other people have been held up in ERs for women trying to get pregnancy tests.
What? Like I said, I'm sorry, but you're describing something that happened in our current system. I don't understand. You're describing our current
Yes,
health
though.
system.
With the free healthcare that they are getting.
How do you know what healthcare they were getting?
Because it's very, in a sense, you're going to go pay $3,000 for a blood test.
What?
You're going to go pay $3,000 for an ER visit.
Yes, people pay lots of thousands of dollars at ERs. Yes,
to get a pregnancy test.
I don't think it should cost anything. I think it should be free.
And that's why women have admitted to going to the ER for sonograms
What
and
does this
pregnancy
have to do with
tests.
what we're talking about? I understand people do that in our current system. We should have it, areas that are set up where people can go get pregnancy tests that aren't the ER where
I
you can
don't
go
I don't
right away.
think that you get that this is kind of where you're gonna head to for a while with this.
When you're saying head to for a while, you're describing something that already happens.
That's the thing. That's where it's gonna be for a while. And that's where you're gonna flood the healthcare
Let's see.
system.
Okay, I'm trying to look it up right now. It looks like Planned Parenthood provides pregnancy tests. It looks like they
Not
do.
everywhere has a Planned Parenthood.
Exactly.
A lot of states only have one.
Exactly. I think that they should, though. I think that they should have Planned Parenthoods, and I think people should be able to go. They shouldn't have to go to the ER. They should be able to go get their pregnancy test at Planned Parenthood or any. I'm not trying to I'm not trying to create a monopoly with Planned Parenthood. I'm just saying you can have It is possible to have places where people can go get pregnancy tests that aren't the ER.
Yeah, I don't think you understand the full scale of everything with it. That will be
I,
clogged.
I promise you. This is what I'm going to ask you to do. Just look at other countries that are already doing it, and
Yeah, but
are they satisfied? You should look at a country, and then look at what that country says about their healthcare. Like look up a poll about what they are satisfied with their healthcare, and then look at our country and look up a poll of if people are satisfied with their healthcare. I promise you, it will be higher in the country that has socialized medicine.
yeah, also I would probably recommend talking to multiple doctors and nurses in different fields in different areas and ask them kind of how they would feel about it too, with what they're already currently going through.
If they would support people getting, it's my understanding that most doctors hate how many, like for example, they have to spend like hours doing paperwork rather than treating people, which is what they want to do. They have to deal with insurance agency. They have to do all of this stuff. Most doctors just want to treat people. That is why they get into the business.
Actually,
They want to help.
if they have a practice, they're not the ones dealing with the insurance agent, with the insurance
Awesome,
company.
awesome. But there are doctors that do. I promise you, there are doctors that say that they spend way more time on paperwork than they would like to. They spend so much more. When what they really want to do, the reason that they became a doctor is because they want to help people. And I promise you, the last thing they want is they only want to help rich people. They want to help everyone who needs help.
Yeah. I'm just saying I would just recommend doing that and kind of discussing with them about that point, and ask them kind of how they see their books filling after that.
Yes, they would probably say that they would like that they would like there to be more doctors. Most doctors would say they like to be more doctors. Like I said, countries with socialized medicine, there are a lot of them that have more doctors per capita than we do.
Okay, I'm gonna hop on out.
All right, awesome. You have a fantastic day.